اللي هو inter and intra-professional cooperation. So it's going to be between the pharmacists and other healthcare providers. That's what I said actually. So
Yes, exactly. Most likely here, yeah, do not expect any referrals here. Okay, so you are in a hospital setup. You may, if you have a nurse or like a whatever healthcare practitioner who's not a physician or who doesn't have the authority to prescribe any medications, you may get back to him or ask the healthcare professional to call the doctor or to verify with the doctor anything. Okay. Usually in the hospital setting as well, or for any indoor patients, there's some like important questions, flashing questions here you have to ask. What about the health? Excuse me, what about the liver and kidney functions, for example? Okay. If there is any like specific measures or values, like here you are talking to a healthcare professional, you feel free, so you can feel freely to ask about like what about the creat clearance, what about the liver enzymes, what about the cardiac enzymes, and etc. Okay, you may go a little bit deeper than the normal like the regular patients. تمام، واضحة البوينت دي؟ فهو في الهوسبيتال هنا غالبا بتتسأل بقى أسئلة مخصصة شوية، بتدخل شوية في in depth. Okay.
lay language is not mandatory here. So since you are like dealing with a healthcare provider,
Yeah, exactly.
so you can ask a medical question or you can talk medical more as you wish. So it's not a big problem. Okay.
And yes, and don't forget please the patient rapport here, or the communication or the counseling role of the pharmacist to the patients. Okay, like if you give if you give your recommendation to a physician and it's a new medication for the physician or something, okay, it would be better if you ask him or just to show your empathy to the patient or show your collaboration with the physician in managing the patient condition. You can simply tell that I can contact the patient to give him a proper counseling about the medication and how to use it, and give him an overview about the expected side effects or something to be well prepared, okay, and etc. Okay, it would be better if you can show the empathy or show the collaboration with the healthcare professional here. Okay, في الآخر كده بتبقى دي كويسة دي. It should be counted in the intra-professional communication. What is this? Okay. So let's start, I think. Do you have any questions about this setup? Any questions?
ايوه دكتورنا بعد اذنك.
قول يا باشا.
هو هنا اللي في اللي في الستيشنز بتاعت الهيلث كير بروفيشنال، انا ممكن اعمل امباثي
في الاخر بتعمل مش يعني انت بتشو الامباثي مع الهيلث كير بروفيشنال للعيان مثلا، زي ما قلت لك في الاخر كده انت بتقول والله يا دكتور لو عايزني اكونتاكت البيشنت وادي له proper counseling about the medication, like how many doses for example, like side effects، الحاجات دي كلها انا ممكن اتواصل معاه برضه وادي له counseling، لان انت هنا وغالبا ممكن ما تشوفش العيان.
اوكي، وده يعتبر اللي هي امباثي ولا يعتبر كوميونيكيشن؟
لا في الاخر دي تعتبر collaboration او cooperation مع الهيلث كير بروفيشنال اللي قدامك.
تمام. اوكي.
بس.
يلا بينا. Who gonna participate يا شباب في station number 1؟
اوكي بقى.
محمد خلاص. اوكي محمد ماشي. طيب صياد ممكن تمسك التايمينج Can scroll down.
Yeah, station number 1. Okay, 1 moment. I'm gonna send you the reference.
So the reference will be on the group, or on the WhatsApp group, or here?
In the WhatsApp group, yes.
On the WhatsApp group. I have OSCE 1 and OSCE 2. Which one?
I believe he sent us
Will
on
be
both.
shared. Will be shared to both.
Okay.
Both. I believe so.
Okay, here we go. Station number 1. Okay, here it is. And we're gonna forward to station OSCE number 2. Okay, guys, are you ready?
Yeah.
I'm ready.
Count 30 seconds and then he's gonna start.
Okay, I'm ready.
Just 1 moment. I don't know which one. Is station number 1?
Yes.
Yeah, palperidone. Okay. You have
Bring
it? You have the reference?
Yes.
You're sharing the reference, Muhammad. You just bring me the station itself.
Yes. Here we go. So you have 7 minutes. You have 30 seconds just to
To do what?
be at ease. You have 30 seconds before we start to just to be at ease with the reference you have. Okay.
Okay.
انا الريفرنس في الاول بنديهولك بس كده عشان ايه يعني ال 30 ثانيه دول عشان يعني تقلب كده في الريفرنس وتشوفه مثلا. هو في
Okay.
الامتحان ما بيبقاش فيه 30 ثانيه ولا حاجه، بس انت هنا عشان احنا في اونلاين سيت اب او ديجيتال
Okay.
سيت اب فبيبقى بالظبط كده، بتاخد وقت شويه. طيب يلا
Okay. Ready.
انا معاك 30 ثانيه وبعد كده هقول لك ستارت.
أبدأ.
Yes.
Yes, start.
Hi,
Hi.
my name is Mohammed. I'm the nurse on the floor today. So our doctor wrote me a prescription, so I want to administer it, but I don't know how often should I give it to our patient. Can you please help me with that?
Sure, Mohammed, I can help you on that, but please first of all have a seat in the private counseling area so we can discuss it.
Yes, no problem.
At the first, I'd like to welcome you at the pharmacy and thank you very much for involving me in the patient cycle of care. Could I have please your concern?
The resident doctor gave me a prescription. I dispensed it from. I took it from you in the morning, your pharmacy in the morning, but I don't know how often should I give this.
Sure, I can help you on that. Yes, I see the prescription here in front of me. The prescription for patient Salma Hayek. Is that correct?
Correct.
Her age is 45?
Yes.
Yes, as I see here that it's for palperidone, the Inviga Trenza, which is the intramuscular injection, the long-acting one. Okay.
Yes. Yeah.
Okay. What's your concern, Mohammed?
Yes. How often should I give it?
Sure, I can help you on that. But can I ask you some question about the patient profile so I can give you the best advice for that?
Yes, no problem.
Does a patient was on the palperidone oral tablet before?
It was before a long time ago.
Long time ago. Since when?
I don't remember.
Perfect. So you will start today on the long-acting injection. Is that correct?
That's what the resident said. It's a long-acting, yes.
Okay, sure. So just give me 1 minute to check my reference and to get back to you, okay?
Okay.
Okay, doctor. Okay, Mohammed, I see here the patient profile. Sorry, it wasn't here before. So shall I go with the patient profile with you first?
Yeah, no problem.
Do the patient have any problem in the kidney or liver function?
His vitals are okay.
Sorry?
No problem. They are
No
okay.
problem in that. Okay.
Function well.
As I see here, she has an allergy for the pollen or
Peanuts.
and peanuts.
Yes.
Are there any updates?
No, no change.
Great. She's using Alice for the as oral contraceptive, and is that correct?
Yes, she used to.
Also Inviga, which is from 50 to 75 to now 100. She's on any one of them right now?
The last time she took it, the 1st of March, from her pharmacy, from Enviga Sustana.
Okay. So she's 3 weeks now on the, or 4 weeks, you mean, on the Enviga?
The last time now it's 4 weeks, I believe. Now it's 4 weeks.
Okay, that's great. طب ممكن يا باشا ارجع للروشته الاصليه بعد اذنك؟ Okay, thank you. Okay, just give me 1 minute. I'll check it back again.
Two minutes remaining.
Okay. So she was on the monthly injection IM.
Yes, she was in the monthly, yes.
And the new one will be monthly also, or will be each?
That's my question. How often should I give it?
Okay. ليه كلها مانجنج بيست دوز كده؟ في حاجه ثانيه غير؟
أخبار الوقت إيه يا محمد؟
الوقت خلاص بيخلص.
بس ثواني ثانية بس خلاص. Time is
Okay,
up.
time is up.
Okay, doctor. Thank you very much. I will contact you later because I couldn't find my the data right now in the reference, so I will contact you later regarding that. Okay.
ماشي، أنا مش دكتور عموما يعني، أنا كنت نيرس بس ماشي. متشكرين يا سيدي. Someone else
You
want to
didn't find
participate?
the answer, right?
Yes.
You didn't find the answer?
monograph and the reference you have. ما لقيتهاش خالص.
Okay. Someone else want to participate? Sunil. Sunil, do you want to participate?
Yeah, I can do that.
Yes. Okay, let's do that.
Okay, right. So let me see. Can you start the
So
timer?
you're gonna start, yeah, you're gonna start right
Let's
away,
start.
okay? There's no
Let's
30
start
seconds.
right away. Okay, no problem.
Yeah, go.
Okay,
1, 2, 3.
Okay,
right.
hello. My name is Mohammed. I'm the nurse on duty today. Are you the pharmacist?
Yeah, my name is Sunil. I'm the pharmacist on duty. Please have a seat, Mohammed. How can I help you today?
Okay, so our resident doctor wrote me a prescription, and I picked it up in the morning, but I don't know how to use it, like how often to use it for our patient. So can you help me with that?
Okay, can you give me the patient first and last name?
For Salma, first name, Hayek is the last name. It is 40 years,
Okay.
45 years old.
Okay. All right. So I can see the prescription Invega Trinzana, IM injection. Okay. Can you scroll down to the patient profile, please? The next page. Hello?
Mohammed, can you scroll down, please?
Can you scroll down to the patient profile?
Sorry.
Yeah. Okay. Yeah, I can see she's having allergies to peanuts and pollen. Right. She's also using at least 21 tablets, at least 21. And okay. So previously she's using Invega Sustain. I think it's a monthly injection. Okay. So let's just give me. So just give me like few minutes. Let me check my reference and I'll get back to you. Okay.
Okay, no problem.
Yeah. Thank you. Okay, all right. Thank you very much for your time, Mohammed. So this medication, like the patient, she has to get one more dose of the Invega. She has to get the one more dose of sorry, Invega Sustainer before she can get the Invega Trinzana, because at least four doses of monthly Invega Sustainer should be given before we change it to Invega Trinazana. And so in this case, like I'll contact the doctor and like tell him to tell him to change the prescription to Invega Sustainer, because after 4 doses, like she got 3 doses. So after
But
the 4th dose,
he's due now for another injection, and the doctor just left, and another doctor is coming. So should we? I believe so. We don't give it. We will not give it. You will not give the Trenza?
no, I mean it's a monthly injection. I can see like there's few more days. Like it's okay.
Yeah.
So like she like the patient is okay for a few more days. So in the meantime, hopefully the doctor get back, on the prescription. Okay. Do you have any?
So okay, no problem. So you want a prescription for Invega Sustenna?
Yeah. So actually, the procedure for going to Invega Trinzana is like at least 4 doses of Invega Sustenna. And so since she's like, I can see she got like 3 doses from our pharmacy. And I think the 4th one, after the 4th one only, you can move to the Invega Trinzana. Okay.
Amazing. Okay.
All right. So
Okay.
any
So
other
then
questions?
no, thank you so much.
Yeah. Thank you.
Okay. Thank you, my friend. Thank you, Sunil.
Yeah.
So you got it right, my friend. So Invega Trenza is every 3 months. Okay.
3 months. Yeah.
We can only give the Trenza if we give like at least four injections of Sustenna, and the last 2 has to be of the same strengths. The last 2 injections has to be in the same strength. So let's say, for example, if next time, if he give her 150, that still he cannot give the Trenza. So it has to be minimum 4 injections of Sustenna every month, and the last 2, it has to be maintained on a specific strength in the last 2 injections. Okay, and this is very obvious in the dosing part of the thing we give you from the up to date. Okay. Okay, Sunil, but you got it right actually. And there is a refill remaining if you can look it up in the patient profile. And there is a refill remaining. So
remaining, yes, that's right.
Yeah.
Okay.
Thank you, my friend. Thank you so much. ماشي Mohammed.
I have a question.
Yeah.
Yeah, while I was looking at the patient's profile, I was wondering, it looks like this patient skipped a dose from January to March.
Sorry, what's your question, my dear? You want to go to the profile?
Yes, the patient's profile, not the prescription.
Yes. Scroll down, Mohammed, please. Yeah.
Because the first thing that caught my eyes was the date. The patient skipped a dose from January to March.
The patient what?
It looks as if the patient
more
missed
than
a
1
dose.
month between January and
monthly.
March.
Yeah.
So he stayed more than 1 month between January 27 and March 1. Why
And
he didn't
March
take it
1.
on February 27?
Yes, that was the first thing that caught my attention. Like there's something wrong.
Oh, okay. I got what you mean. You mean that he missed a dose?
Yes, this patient missed a dose. So I was also looking at the missed table.
Why he missed the dose? Why he missed the dose? Why?
He didn't miss the dose.
He didn't
No.
miss the dose.
7 days
it's
up
1st of
or
March.
7 days down, it's fine.
Yes, exactly.
February is 28 days.
Yeah. February is 28 days. Exactly. There's no missed dose here. And it's 1st of March.
Okay.
Got you.
Okay, my dear. No problem. Can we refill as the
Any
still
questions?
refill?
Is it clear?
Can we refill as the still refills are remaining and those should be the same as the last dose? It depends on the doctor. So if he's okay with the last dose, so at this point, after that, we can give no problem using the remaining. And then after this, we can give the trends. Okay. It's okay. It's a simple one actually. It's just a matter of how you're gonna. For example, Mohammed, you didn't find the answer because we didn't look on the right spot. Here we're talking about the dosing, so you should have looked at the dosing from the first second. Okay.
Yes, I found it. It was about a little paragraph. Yes.
Yeah. It's just below the table. That's it.
Yes, I saw it.
Tamam. Because we can, I believe it's an easy one. Yeah. Station number 2.
Just a question for the past medication, the suspension with the not the Sustenna, the doses that was on the patient profile are not actually the doses that are available on the market. Does it come as a pre-filled syringes, or do
It is
we
a
have?
pre-filled syringe. It's a pre-filled syringe.
Okay, because I couldn't find the 50 milligrams per
15 or
milliliter.
50, 50, not 15.
Yeah, I couldn't find it. There is only 39 milligrams per 0.25 milliliter, and the 78 and the 78 milligram per 0.5 milliliter, and then 117 milligram per 0.75 milliliter.
I will send it as a page, as a human second.
Okay.
Okay, human second. Are you on the WhatsApp group?
Yeah.
Okay. They are on the WhatsApp group. Okay.
Thank you.
You found them?
Yes, I can see.
Okay.
Okay.
ماشي يا باشا.
Yeah, I can see it. Thank you.
Okay, very good.
Okay.
Let's proceed with station number 2. مين اللي جاي؟ Sonil, you have done already one, right?
Yeah.
Okay. Can you put down your hand, my friend?
أسامة سلام. أسامة وفي صفا. يلا. أوكي أسامة. يلا محمد.
Yeah. Yes.
في دور نوت ولا حاجة؟ reference.
There you go. This station. Okay, it's not. I think this. We brought this station in one of our mock exams. I think الستيشن دي حلوة وظريفة. احنا جبناها قبل كده في موك exam. بس من الحاجات الستيشنز الكويسة. I'm gonna send you. Actually, you don't need any references here, but let me.
Okay.
But yeah, anyhow, like. احتياطي كده هبعتها لك برضو. Here we go. This is number 2. Yes, here we go. I'll send you now station reference number 2.
لو مش موجود خلاص أنا هاخد ال RxTX.
موجود خلاص زي الفل. اوكي
تمام.
You got it. يلا يا باشا.
خليني بس افتحه.
تمام. جازولي هتاخد الوقت ولا ايه؟
هاخد الوقت.
طيب 30 ثانية في الأول وبعد كده ايه نبتدي على طول. Are you ready, my friend?
Ready.
جاهز يا باشا؟
يلا you can start if you would like.
يلا 30 seconds. Go ahead. هو بياخد 30 ثانية ولا تبتدي على طول؟ مش فاهم. 30 ثانية ولا خدتهم خلاص؟
خدتهم. يلا let's go.
ابتدي يا جازولي. Okay.
يلا. Hi, I'm Mohamed, the pharmacist on duty today. How can I help you?
Yes, hi. Actually, my name is Janet. I'm a nurse here in the hospital. I have a question about one of the patients here in the pharmacy.
Okay.
Okay, so
Okay, of course I can help you with that, but first of all, you may have a seat and make yourself comfortable.
yeah, thank you so much. So kind.
Okay, first of all, may I have your name, please?
My name is Janet.
Janet. Okay, how are you, Janet, today?
I'm good. Thank you.
And can I have our mutual patient name and age?
Yes, it's for Mr. Will Smith. His age is 84.
84, okay. I can see his profile now. So
Yeah.
can you tell me more about your concern?
Okay. Actually, it's not my concern. It's his wife's concern. Mr.
Okay.
Smith has suffered about 2 or 3 hypoglycemia recently, about within the last 3 months. And we served him before the glucagon injection, but his wife encounters usually some difficulty in injecting the glucagon. We heard about the Baqsimi, the new medication for the severe hypoglycemia situations, and we thought about giving him one of those. So I wonder if you can help me in the management of that. How can we administer the Baqsimi to him?
Okay, of course, I can help you with that, but to assist you in a better way, I need to go through his profile real quick with you. So he's on Novorapid, 100 units, and insulin MPH, Ramipril 5 milligram. Does he have blood pressure, hypertension?
Yes, he's hypertensive as well.
Okay, is it controlled?
I believe.
Okay. So atorvastatin, does he have high cholesterol?
Yeah.
Dyslipidemia? Okay, and is it controlled?
Yes, I think.
Okay. What about his diabetes? What was the last HbA1c reading?
Usually it was well controlled at about
Well controlled?
6 or something like that, 6.5.
That's good. That's good. Okay. Any kidney or liver function test recently?
Yeah, they are just fine.
Just fine. Okay. Does he has any other medical conditions other than diabetes and hypertension and dyslipidemia?
No, that's it, I think.
That's it. Does he has any allergy?
Not according to my knowledge, no.
Okay. And his vaccines are updated, right?
I believe, yeah.
Okay. Do you have any idea about his lifestyle?
Like what?
Like exercise and alcohol intake, caffeine?
No, I don't. No, he doesn't exercise.
Okay.
He's 84.
Okay. Yeah. What about his diet?
Regular one?
Okay. Let's see. Okay. Does he drink alcohol?
Maybe.
Okay. Do you know what did happen like before his hypoglycemic session episodes?
He got 3 recently. He's encountering about more frequently hypoglycemias. It's about 3, according to his wife. He suffered about 2 or 3 hypoglycemias in the last 3 months.
But did they notice like any new things that happens before hypoglycemia, like increased effort or
I don't
missed
believe
meals
so.
or something?
No,
Okay.
usually I'm their nurse. They are following up with me usually. This is the first time she told me she mentioned something like that.
Okay. And at what time of the day usually experience as hypoglycemia?
Usually it happens afternoon at 2.
At 2. Okay.
Yeah.
Okay. Did he visit his doctor regarding this concern?
No.
No. Okay. So give me a moment to check my reference and I will get back to you.
Yes, okay,
Any
go
more
ahead.
questions
Yeah, my
before
concern about the Baqsimi, yeah.
Yeah. Okay, I will address this in a moment. Okay. Two minutes left. 2 minutes left. Okay.
Okay, thank you for patiently waiting. So yeah, he can use a vaccine.
How can we use it?
What?
How can we use it?
How
How
can he?
many doses
he
we need?
Yeah, it is 3 milligram giving intranasally. Okay.
Okay.
And he should take it intranasal only. The recommended dose is 3 milligram. Administer at one actuation of the intranasal device into one nostril. Okay. Don't push the
nostril?
plunger. One nostril. One nostril only. Okay. And that's it. And if you can refer him to us to counsel him on how to use it, and we can counsel him as well on the side effects and give him some.
Oh, he's bedridden. I believe no. He's like a bedridden or something. He cannot move.
Okay. Okay. So he should also be okay. Okay. Any more questions?
Thank you so much, my friend. Thank you so much.
Thank you.
Okay, have you ever seen this station before?
No.
Any of the attendees? Have you ever seen this station before in one of our mocks?
No.
حد شافها قبل كده الستيشن دي؟
لا.
يا راجل.
ده انا الدواء اول مره اشوفه اصلا.
كنت لسه هقول did anyone came across this medication in the pharmacy؟
خالص never.
طب حلو والله. لا الدواء ده مهم الدواء ده.
ده مهم.
Getting more and more important.
أنا شفته بتهيألي.
Now he's covered. Yes, it's covered by most of the insurances now.
Yes.
طيب مين اللي بيتكلم ورا في الخلفية كده؟
أنا.
ميوت بقى.
ميوت ده ثانية واحدة بس تمام. اوكي فيري جود. طب كويس ان انتم ما تعرفوش الستيشن دي بقى. طب تعالوا لي بقى تاني. السجل دي اصل عملناها قبل كده في موك فقلت هتنتشر يعني بس كويس ان انتوا الدفعه دي شكلها ما حدش يعرف الستيشن دي. اوكي good. So we have two options here. Okay. Either to proceed with the assessment or to retake the station with other candidate. What do you think? What do you want?
We do it both.
Can I try the station?
Yes, Noura. عربية Noura? You're not. Where are you from?
Africa. I don't speak Arabic.
Yes, that's right. Because Noura is like a famous name here in Quebec, but it's of the Arabic origin. You know that?
You said so the other last class.
Yeah, there's so many Quebecois here have the same name, Noura, but they don't know what does it mean.
Light.
Like what? Light. Yes, exactly. It's light. Okay, very good, Noura. يلا بينا. We're gonna start. Would you watch the time, Gazouly, please?
Yeah.
Okay. Yes, hi.
Hi, I'm Ola I'm Nora the pharmacist. How can I help you?
Yes, Nora. My name is Jeanette. I'm a nurse here in the hospital. I'm concerned about one of the patients here. His name is Mr. Willismith. He's 84 years old. His wife is a little bit anxious about his medical condition. It tells me that he suffered about 2 or 3 hypoglycemias recently, which wasn't the case before. Okay, it started recently. So I dispensed them before the glucagon injection, but it's not any more practical to his wife. She found it difficult to be injected, to administered. That's why we heard about the Baqsimi, the new glucagon in nasal spray form. I believe it would be an easier option to hear. Would you give me a counseling about the medication and how to use it?
Oh, sure, Janet. I'll be glad to do that. Just a few questions in regards to the patient. Is this patient an inpatient or outpatient?
He was inpatient, now he's an outpatient.
Oh, okay, sure. And I can see on the patient's profile that the patient takes insulin, Novorapid insulin before meals, and also takes MPH, 20 units in the morning and 20 units in the evening. The patient is on Ramipril 5 milligrams, 1 tablet daily, and also on atorvastatin. Do you know if this patient has any allergies?
No allergies.
No allergies. Okay. Okay. Aside from this medication, do you have any information about the patient's lifestyle?
Like what?
Like, does this patient drink alcohol? Does he smoke?
If that would bring any difference?
Sorry?
If
No?
that would make any difference with the choice of the Baqsimi?
Oh, no, not at all. Not at all. It's just to have an overview assessment of the patient. Okay, and just to confirm, is this patient a type 1 patient?
No, type 2.
Type 2, okay. Okay. And you did say that the wife says he's had frequent hypoglycemic episodes. Do you have an idea of what the reading is whenever they get the hypoglycemic episode?
The H1AC?
No, the fasting blood, just the blood sugar.
Ah, yeah,
reading.
the fasting one was 7.5.
Okay. Okay, Najina, please give me a few minutes to just check my reference, and then I can provide more information on how to use the Baqsimi for you.
Yeah, go ahead.
Okay. Okay. Thank you for your patience. So the Baqsimi, it's a nasal powder. It's a glucagon nasal powder. It comes in strength of 3 milligrams, and it's to be used in the nose only. It's important that this medication is administered into 1 nostrils, and before administration, do not push the plunger or test the device prior to you giving it to the patient. This injection can only be used in emergency situations. And so it's also important that we also educate the patient and family and friends. I did hear you say the patient is quite elderly, so I need to educate his wife as well on how and when and how to use the nasal powder injection. This medication is actually administered. You administer the dose by inserting the tip into 1 nostril and pressing the device plunger all the way in until you see until the green line is no longer showing. And it's important that the patient calls for medical help as soon as possible. And once the patient responds to treatment, we need to give the patient oral carbohydrates. If the patient doesn't respond within 15 minutes, then an intravenous glucose will have to be administered to this patient. A quick question, Nurse Janet, is the wife open to other sources of other ways of managing hypoglycemia aside from the intranasal powder?
Yeah. What's the question? Excuse me.
Is the patient open to other forms of managing hypoglycemia aside from the intranasal powder?
No.
2 minutes left.
Okay,
2 minutes
so
left.
okay, so in this case, this is what we'll need to do for this patient. Administer the powder into 1 nostril. The powder is not to be inhaled, and once it's given, we have to call for emergency help as soon as possible and check the blood glucose after 15 minutes. If the blood glucose is still not up after 15 minutes, then we'll have to give the patient an intravenous glucose solution. In case it is severe, in case the patient is experiencing severe. I also encourage the patient to always have like carry along with him the it's a light source of carbohydrates, about 15 grams of carbohydrate and protein. It'd be a light snack right away. It's also for this patient too, I would also recommend, like, if the doctor is open to changing the insulin for this patient from the NPH to an analog insulin, maybe like the glargine or something that has less hypoglycemic, prone to hypoglycemia. In addition, Nurse Janet, I would also encourage that we reduce the HbA1, the target for these patients, since this patient is experiencing frequent hypoglycemic and the patient is also elderly. And it also seems to me like this patient needs support from his wife and family. So maybe reducing the glycemic control, the target. Do you have an idea what the target is for this patient?
The target for A1C, right?
Yes, please.
7, less than 7.
Less than 7. Okay, so there will be need to review the target and increase it a little bit more, not trying to get it close to 7, maybe between 8. Might be better for this patient. This is the patient.
Time is up.
Okay, good. Okay, good counseling.
Amazing.
Okay, but here I have a question here. What's the main problem of this guy?
I think the main problem is the NPH. To be nicer to switch it, I think.
Yeah, okay. The main problem is the hypoglycemia, right?
Yes.
This is a trouble here. Okay, but why you didn't find out the reason for this hypoglycemia? Both of you didn't. Okay, neither one of you tried to find out the reason of this hypoglycemia. You asked only one question, I think, which is a relevant one. At what time of the day he got this hypoglycemia, right? This was you.
Yeah.
It was you who asked this question, right? This is a valid question. Okay, but you didn't continue in your investigation. What's the problem? To know, this could indicate something. If you asked about at what time of the day he takes the MPH dose, for example, okay? And another point, you asked only about the fasting glucose. Surprisingly, you didn't ask about the H1AC, and neither the postprandial readings as well. I don't know why. Why only?
About HPC.
Yes. Osama asked about the HA1C and didn't ask about the fasting nor the postprandial. Okay, but Noura asked only about the fasting. I don't know why. What's the reason for that? I told you 7.5, right? Is it controlled? It's not controlled, right? Okay.
It's not controlled, yes. 4 to 7.
Yeah, 7.5 is not controlled. Okay. But if you ask it about the HA1C, I will tell you 6.5. It is controlled here. Okay. So the problem is in the fasting, number 1. What about the postprandial? I will tell you 7 if you would have asked me. Okay. So here we have fasting blood glucose, glucose is 7.5. We have postprandial 7 and have H1AC 6.5. So the problem here is about the fasting usually. Okay. Fasting is not controlled because he takes NPH. What time of the day he takes the NPH? I will tell you at noon, at 12. At what time of the day he gets the hypoglycemia? I will tell you usually afternoon, about 2 or 3. For what? Is there any correlation here? I assume yes. Could the NPH peaks within 2 to 3 hours after the dose? When he got his peaks, the risk of hypoglycemia is the greatest here. Okay? So the problem is the NPH. What we have to do here, we have to treat the hypoglycemia. We have to address this problem. So the first thing to do is to change the NPH to long-acting one to control the fasting glucose level, the fasting glucose one, and to decrease the risk of hypoglycemia. Okay, this is number one. Number two is about the bacemia. Yes, you can give a counseling, a full counseling about the bacemia, how to use it, and etc. There's no problem about that. But you didn't ask as well if this hypoglycemia is a severe or like a regular hypoglycemia or normal one. صح؟ حد سأل يا أسامة؟
No.
Okay. Okay. So and sometimes it's
Okay.
severe one, sometimes it's not. Okay. This is number two. Anyhow, yes, the I would say that the proper handling of this situation is to address first the problem here. The problem started recently, and this is very critical when you hear this word recently during the last 3 months. The situation is not going well as usual, and that's something. So 100% there is something happened recently. So you have to ask, when did he start his medications, for example? If you would have asked me about this one, I would tell you the MPH have started about 2 to 3 months ago. Okay? The situation solves itself, but the first thing to do is to get to get your steps on the right road. Not asking any question. Why are you asking about the lifestyle and alcohol and it's something? Why you asking this question?
I was asking that because I wanted to focus on the diet to see if the diet was the cause of the hypoglycemia. That was why I was asking the question. I wanted to ask about the diet,
And
alcohol.
exercise. I think one of you, yes, it's Osama, asking about the exercise.
I wanted to ask the alcohol and the diet because
Yeah,
I felt
I didn't notice the age.
No need for that.
But I asked you for exercise and diet because this can affect like
Simply
hypoglycemia.
speaking, you can ask her very simply, do you believe that the lifestyle could be a factor here to cause this hypoglycemia? I would say no, I don't believe so.
Okay.
Okay, so no need to ask about the lifestyle and the regular eating habits and alcohol. It would take it took about 1 minute asking about irrelevant questions. Okay, is it clear?
Let's move on to next station.
Yes. حد عنده أسئلة في الستيشن اللي فاتت دي؟
Okay, who's gonna participate يا شباب؟ We need the participants.
Me.
Me. صفا.
Sorry.
مي. ماشي. يلا صفا. Station number 3.
الستيشن فين؟ هو فيها دي ريفرنس ولا ما فيهاش؟
I'm not sure بقى. انزل كده اشوف ديت ايه بتاعت الاير انفكشن. يب اوكي ماشي يلا بينا. You can send it. يلا يا عم send it بقى.
حاضر. This one is a tough one. Okay.
يا عم.
بس بشجعك.
ما تقولش كده يا عم.
No problem.
المصري، انت مصرية يا صفا؟
No.
صح؟
لا عراقية.
عراقية والله لسه هقول.
طب دول أكتر ناس دول.
هسه تقولي هسه برضه زي العراقيين؟
بالعكس المصريين ما شاء الله عليكم كتير شطار.
طبعا الحمد لله.
كتير ما شاء الله والله.
احنا شاطرين بس الأسعار بتغلى عندنا. يلا هسه هنبدأ يا صفا.
30 seconds yes. امسك يا محمد الستيشن التايمنج if you please.
ثانية واحدة حاضر ثانية واحدة. واحد اثنين ثلاثة go. There is 30 seconds first.
30 seconds. So she has a chance to open the reference.
So start.
Okay.
Hello, are you the pharmacist?
Yes, I'm Safa, the pharmacist on duty. How may I help you?
Hi, I wanted to give you your opinion about a case here. I have a 18-month-year-old kid. I want to give
Yes.
him cefiprozil 250 milligram or 500 suspension, 3.5 ml, twice daily for 10 days for ear infection.
Okay. For sure, I will help you with that. Just to know, this is our private counseling area. Everything will keep confidential. Okay.
Okay, no problem.
So I see the patient name is Oka Ortega.
Yes.
Okay. So for what indication?
I told you, it's an ear infection.
Okay. Okay. Ear infection. Okay. And you want to prescribe cefiprozil?
Yes, I want to take your opinion about if this the right action for him, the best action for him.
Okay, no problem. So can I just confirm the weight of Oka?
The weight?
The weight, yes.
Actually, they checked the weight, but it's written properly. We checked the weight before with my doctor. It's I believe 11.5 kilos, something like that.
We have a patient profile here.
It's here. It's here.
Okay. So okay, is this doctor station or a patient?
Doctor station.
Okay.
I am the resident.
So doctor, is it for the ear infection? Is it recurrence or the first time?
No, it's recurrent.
Recurrence. Okay. So I see here on the profile.
Yeah.
On the profile, it's this patient is taking clarithromycin 125 suspension. So for what indication?
Yeah, for the same thing.
For the same things, and it didn't work for the ear infection.
Yes.
Okay, but okay, and okay. Okay, I see the patient has allergy to penicillin, sulfa, and diphenhydramine. Can you prescribe for me what type of allergy he has for penicillin?
It started itchy.
Oh, okay. Itchy, okay. So it's anaphylaxis.
No, it's not. It's just itchy.
Just itching, without shortness of breath or swollen like tongue or something?
No.
Okay. Okay. So the clarithromycin, it's say the prescription already dispensed. So
yeah,
is the patient taking clarithromycin right now, or what's happened exactly?
No, it stopped 10 days, a long time ago.
Okay. Yeah. So doctors, can you just give me a few moments to check my reference?
Yes.
So can I know just the reason for recurrence? Like, is the patient taking the medication regularly as prescribed?
Yes, it's just recurrent.
Okay.
The patient is going to the daycare, to my knowledge.
So the patient taking the medication is going to the daycare at the same time?
He usually goes to the daycare.
Okay.
Yeah, go to
Just
school.
I need 1 minute to check my reference, please.
Okay.
So about the kidney and liver function is normal?
Normal, yes.
Okay.
Two minutes remaining.
Okay. So I see the medication is right to dispense.
Okay, that's the best option for him.
There is a few options here. It's high dose amoxicillin clav, or cefoprozil, or ceforexime oxytal, but it's on the profile. It's say for ceforexime it's already dispensed and prescribed instead of amoxicillin because of the penicillin allergy.
Okay.
So
what is the best option?
So it's all penicillin and cephalosporin, not founding.
Okay, time is up.
Yeah, okay. I'm give up.
Okay, anyone else want to participate?
I told you this is a tough one.
Yeah, really hard.
It's a tough one, yeah.
Hmm.
It's not easy, but it's a good.
Can I go for this one?
Thought
Yes,
provoking.
Marwa. Yes, Marwa is yes. Here we go. Let's start right away, please. Okay.
Okay. Hi, my name is. Hi, my
Yes.
name is. My name is Marwa. I'm the pharmacist on duty. How can I help you?
Hi Marwa, how are you? I'm the resident here. My name is Mohammed. I want you to give me the best option for my patient. 18 months old kid with ear infection. We got him a prescription for cefoprozil, 250 milligrams over 5 ml suspension.
Okay.
To be given 3.5 ml twice daily for 10 days.
Okay, Mohammed, so can you please have a seat and let's discuss this. So first of all, I'd like to ask a few questions regarding the patient. I see here that the name is Oka, 18 months old. So what is the medical condition of Oka?
For ear infection, I said.
Okay, ear infection. Is this for prophylaxis or is it for treatment?
He has an ear infection right now, so I believe we are giving full treatment.
For treatment, okay. Okay, so I would like to check what are the medical history of Oka. So
Yes,
can you please
for
scroll
sure.
down? So does she have any other medical condition apart from otitis media?
No, nothing actually. It's just otitis media.
Okay, and does she take any prescribed medication?
For the moment, no, but she took before some antibiotics in the past. So she took amoxicillin, and she showed some allergy towards it. So we changed it to ceforexime.
Okay.
And then it had a recurrent one episode, and then we give her like clarithromycin as well. And she stopped it, and then she had another episode for the moment. I'm not sure if this one is the best option for her.
Okay, and why did she stop the clarithromycin?
She didn't stop it, she just finished it.
Okay, and then within how many days she relapsed?
Within how many days?
Yeah.
Actually, after like within 2 or 3 months, she came back with the same condition.
Okay, 2 to 3 months. Okay.
Yeah, I believe the last time was on December, something like that.
Okay. And do you have the do you have any suspected bacteria for this infection?
No.
Do you have any results for the resistance antibiotic?
No, nothing from before.
Nothing? How about the previous ones?
No, nothing from before.
Okay, I see also that on the profile she's having penicillin, sulfa, and diphenhydramine allergies. As for the penicillin, you said that it's just itchiness, right?
Yeah.
So it's not a true allergy. Why? Do you know why the doctor switched her to cefuroxime at that time?
Yeah, she was itchy. Yeah, it's a type of allergy too, right? So she was itchy. She didn't continue. It was really bothersome. So didn't continue taking the medication. So we changed it.
Okay, I see. Okay, so Mohammed, can you give me a few moments to check my reference and I'll be back?
Yeah, no problem.
Thank you. Okay, so thank you, Ahmed, for waiting. According to my reference, Mohammed, yeah. So according to my reference, we can, for now, I think that the best option for OCA is to take an antibiotic that would work as a prophylaxis as well for the otitis media.
Yeah.
So it is actually for now recommended to take
2 minutes
amoxicillin.
remaining.
Amoxicillin on a dose of 20 to 40 milligrams per kilo, orally once a day. Yes,
Okay.
amoxicillin.
Okay,
As for the ciprofloxacin, it doesn't have enough. It has less activity against the this type of bacteria. Okay.
Okay.
So,
okay, no problem.
do you have any other questions?
No.
Okay, so
So we should give, to sum it up, so we should give cifeprozil first, and then we give amoxicillin, right? That's what you
no,
said.
we will just go with amoxicillin 20 to
Right
40
away.
milligrams
Amazing.
per kg. Yes.
Okay. Okay. No
Yeah.
problem.
Okay,
Amazing.
then.
Thank you
so much.
Thank you, my dear.
Okay. Bye.
What's your name again? What's your name?
Marwa.
Marwa. Did you check the patient profile?
Yeah, it has penicillin allergy.
Yes, thank you. And you prescribe amoxicillin. Okay. What do you think?
She said like she took it before and she had only itchiness. It's not a
Exactly.
It's not an
And I
anaphylactic.
said it's a bothersome to an extent. We are obligated to switch it to cefuroxime. So she will not take it anymore.
Yes.
Right? That's what I said. You told me the same thing. It's not a true allergy. I said, no, it's an allergy. And she took it and she has itchiness to an extent that she couldn't tolerate it. That's why she stopped it. That's what I said clearly, right?
Yeah, you said that.
Yeah, but you didn't listen to me. You didn't hear me. Same thing like in the beginning. I told you we were giving cefprozil for ear infection, and you, both of you asked for what reason. I told you again. I said in the beginning.
I wanted to double check because the reference it talks only about prophylaxis. That's why I was confused.
Okay, no problem. Okay, so when someone is like allergic to something, we can, and he does not tolerate it, we cannot keep giving it because he will not take it, right?
Yeah.
Exactly. So do you have another option other than amoxicillin?
As per the reference, no.
Yes. No, there is in the reference another option.
Cephalosporin?
We already giving cephalosporin, cefprozil. So what? So you did one part actually, which is right. You said cefprozil to be given or no? You said no, right?
Yeah.
Cefprozil will be given. Okay, because she has already a situation. She has an ear infection ongoing now. So we need a treatment. That's number one. But because she is a high risk and she is like keep having the episode, so we need a prophylaxis after the treatment, right?
Yes.
Okay.
So we agreed on this point. So we have to treat first, and then we need a prophylaxis. Agree?
Yeah.
Okay. So what are the other options for prophylaxis? That's our conflict.
Cephalosporin.
Sulfadoxazole.
can I address this one?
Sulfa monoxide. She has sulfa allergy.
هو
Yeah.
هنا يا دكتور في الباراجراف مكتوب اللي هو تحت خالص
ايوه
ان هو لو في الاثنين مع بعض ما ينفعوش، لا سفالوسبورين ولا اللي هي اموكسيسيلين في البروفيلاكسيس، فولا واحد فيهم هينفع يستخدم في البروفيلاكسيس. بدل واحد فيهم ما ينفعش قبل كده يبقى الثاني ما ينفعش نستخدمه.
جميل. ايه بقى الاوبشن الثالث اللي احنا منتظرينه ده؟
الاوبشن اللي موجود عندنا فيه اللي هو كليندامايسين مثلا، ممكن نستخدمه للطفل.
Have you checked the reference guys؟ انت بصيت على الريفرنس يا باشا؟
حد بص على الريفرنس يا جماعه؟ did you check the reference؟
بصيت عليه والله.
قول ايه الريفرنس؟
هي فين الادويه؟
السيرجري I think.
ايوه مين بقى اللي قال لي السيرجري؟ who said the surgery؟ ليلى. الله يفتح عليك يا ليلى، بالظبط كده. التيوب، الاير تيوب is the answer here.
تمبانوستومي.
Yes exactly.
تمبانوستومي yes.
طب
خلي بالك الريفرنس بتتكلم على ايه؟ ما هي الفكره بس في الريفرنس بتتكلم على ايه؟
طب وبالنسبه للفاكسين يا دكتور، بالنسبه للفاكسين
ليلى برضه
مين اللي قال الفاكسين بقى؟ مين اللي قال الفاكسين؟
انا نوره.
نوره الله ينور على نوره والله.
المصريه
المصريه دي واضح انها مصريه.
انا مصريه بقى.
الفاكسين يا دكتور دي دخلت واحد مصري. حد سال ان السيتي البيشنت دي فاكسينيتد ولا مش فاكسينيتد؟ حد سال؟
بالظبط ده كان سؤالي، هي خدت النوموكوكال فاكسين ولا لا؟ تمام.
ما خدتش النوموكوكال. شكلك عارفه الكيس دي. ما خدتش النوموكوكال فاكسين.
لا انا اول مره اشوفها الصراحه. تمام.
الله ينور عليك. ما خدتش النوموكوكال فاكسين. That's totally true. لو حد سال if someone asked me I would have said she didn't complete her vaccines. So that's an option. Okay. What else? We need to know that if it's like I would tell you about, for example, she is going to daycare, so that's a high risk patient. She has a sibling, and she has like a smoker dad. So
الفلو فاكسين.
لو اللي هو بيروح الداي كير يبقى لازم يبقى ده اللي هو هاي ريسك بالنسبه له.
Exactly high risk. وهو that's why انه high risk حتى even without high risk because it took like so many episodes. Yes. Right? Someone has like more 3 or 4 times a year, so it needs to be treated first. That's number one. Yes. Then after that we have to look for prophylaxis. تمام؟ البروفيلاكسيس هنا يعني the best option is the exactly.
Okay guys, here بصوا هنا factors affecting the choice. What are the risk factors here؟ تك يعني انا اعمل لكم highlighting عليها بالاصفر يعني عشان اللي هي دي. بص الحاجات دي اللي هي تبص فيها. اوكي يعني هي موجودة في الريفرنس عندكم أصلا بالطريقة دي باللون highlighted in yellow like that. بص ال age of child
ده كده معناه إن هو كان البروفيلاكسيس ولا معناه إن اللي هو كانديديت للتيمبانوستومي؟
prevention of prophylaxis. تمام. الفيرست ابيسود حصلت امتى؟ حصلت هو عنده أقل من 6 شهور. ده رقم 1. تمام. بيروح حضانة. بيروح حضانة. عنده اخوات اصغر من 5 سنين. عنده اخوات. ابوه بيشرب سجاير في البيت. ابوه بيشرب سجاير في البيت. التطعيم عامل ايه؟ ما اتطعمش، ما بنودوش تطعيمات. فاهم يعني الولا خاربها يعني ريسك فاكتور من الاخر كده. تمام. فايه اللي بيحصل في الاخر؟ بتبص بقى على التشويس لما بتعملوا بريفنشن انتيبيوتيك بريفنشن بيبقى عندك 2 اوبشنز بنسلين او سلفا، وهو الله يبارك له الرجيك للاثنين. تمام. فبتلاقي نفسك بتروح كده على طول للتيمبانوستومي يعني. هو دي. وهتلاقي تحت يعني كلمة كده بسيطة. هي as we said it's a tough case but it's good. It's like thought provoking as well. It's one of the thought provokers we have here.
طب كان في يا دكتور اللي هو باراجراف موجود اللي هو when to select between antibiotic والتيمبانوستومي صح؟
مش فاهم. قولي تاني كده. في مونوجراف
كان في اللي هو باراجراف
في باراجراف هنا
امتى اختار ما بين اللي هي antibiotic
not this one. I highlighted this as well.
فوق ده
vaccines no.
فوق كمان
choice between antibiotic prophylaxis and tympanostome.
ايوه هنا
تمام.
ايه يعني امتى اختار ده وامتى اختار ده؟ هو هنا مكتوب بس لو في اللي هي antibiotic resistant bacteria in the community in the specific community. عشان كده انا اخترت ان انا استخدم antibiotic prophylaxis، لان انا مش عارف في الكوميونتي في اللي هي resistant بكتيريا ولا لا.
بص الانتيبيوتيك بروفلاكسيس اللي هو كاتبهم لك، كاتب لك ايه؟ كاتب لك السلفا والبنسلين تقريبا، صح؟ مش ده اللي مكتوب؟
ايه؟
مكتوب ايه في الانتيبيوتيك بروفلاكسيس؟ كاتب تعمل بروفلاكسيس بايه؟ مش كاتب سلفا وبنسلين تقريبا، اموكسيلين؟
فين؟
فين هما؟ Antibiotic prophylaxis. It was tympanostomy. Here we go. In the one trial comparing antibiotic prophylaxis.
ايوه هنا هو اموكسيلين.
Here we go.
سلفا.
هنا. We typically use amoxicillin.
هو ده فيه كل حاجه الانتيبيوتيك choice and regimen.
Unless the child has a penicillin allergy. The dose of amoxicillin prophylaxis is like that. The higher dose should be reserved for communities. مش عارف ايه.
اوكي.
سلفاميثازول اهو، سلفيكسوسازول 50 ملغ orally once per year as an alternative. تمام؟ بس هما الاثنين دول. نتكلم دول هما الالترناتيف لبعض يعني في الانتيبيوتيك. That's it.
تمام يا دكتور.
معلش سؤال، هو الريفرنس دي فيها تريتمنت ولا هي فيها بس البروفلاكسس؟ يعني على اساس ان انا اخد قرار ان هو يكمل على السيفوبروزيل او يبتدي السيفوبروزيل.
Check the title here.
اوكي سو ما انا قصدي بقى في الامتحان ممكن يديني ريفرنس على، يعني ده مش حل الكيس الاساسي، ده البروفلاكسس دي ستيب 2، لكن الاساس ان انا لازم اديله السيفوبروزيل.
هو حل الكيس الاساسي في الانتيبيوتيك اللي كان مكتوب.
اوكي لكن الريفرنس ما كانتش دوكيومنتد اي حاجه كده ان
الانتيبيوتيك
انا
ما
ادي
فيهوش
كده ولا ما
مشكله.
اديش.
انت ليه عايزه تغيري في الانتيبيوتيك؟
لا انا مش عايزه اغير، انا بس قصدي ريفرنس ريليتد للموضوع ولا لا، يعني
هو
ريليتد
بيتكلم على
لحل الكيس.
البروفلاكسس. ليه بيتكلم على البروفلاكسس؟ Because it's a
عشان هو
recurrent infection. Very recurrent infection. Okay? But this is the point.
But the main concern was that he came and asked if it's the best option for the patient now, this antibiotic. That's why it was a little bit confusing. Because we didn't.
The antibiotic one, the treatment.
Yeah, I couldn't like make a difference if the resident wants to know if it's the right treatment for the otitis media, or if he wants the prevention. What are the options for the prevention?
No, I said my question was what is the best option for her?
Yes.
I didn't mention any prophylaxis. I didn't mention any treatment. So how are you going to figure it out? By your question. So by the conclusion that you came up as per your question that she has a current medical conditions that need to be treated. That's how the logic says. Okay. And she got it so many times. So for the patient care purposes, we need prophylaxis. So you have to treat a condition and you have to give prophylaxis. That's the patient care. So you have to tackle both things. So my question was open. What are the best options for her? So you have to listen to the question. I don't know what's confusing in my question. You know what you got my point, my dear, right?
Yes, you actually asked a question that it's open, but the reference was only about one thing, which is the prevention. It doesn't contain what's the treatment. That's why I was looking for the treatment option in the reference, but I couldn't find it. It was always all about the prevention.
Cephalosporins can be used for ear infection, no?
Yes, it can be, but I was looking for if it's appropriate, the dose is appropriate, if it's an appropriate choice after recurrent infections.
Exactly. Someone, if you are not aware of anything, just ask. So someone asked me, what is kilograms of the patient? So I said, my upper or my manager doctors calculated properly. I'm not the first one, the first candidate. I'm not sure if you hear this part or not, but always ask. But if you are not aware of anything or confused about anything in the real, like in the real OSCE exam, you can definitely ask, what do you mean by this? It's fine. It's like a communication kind of thing, right? So feel free to ask. I would answer you. So always the actor is work on your behalf, by the way. So the actor will not mislead you at any point. You know. So okay. I got your point, anyways. So
okay, thank you.
Okay, so let's proceed.
Session number 4.
Yeah.
I have a question. In recurrent, we usually use amoxiclav. Since he has been allergic to amoxiclav, why can't we use ceftriaxone instead of the cefprozil? In the recurrent,
for treatment?
Yes,
for
but for treatment, yes, exactly, because he has a recurrent one.
What's the problem with the cefprozil?
Cefprozil, in the table in the chapter, it says if you have a recurrent otitis media, you either give him a high dose of amoxiclav, which he's allergic, so, or an alternative would be ceftriaxone.
Okay, correct. Ceftriaxone 2 grams.
And since ceftriaxone it's gonna be a stronger one, but
it's injection.
Yes, it's injection.
Number one. Number two, this is not the case here. The reference you have reference about the recurrent and the prevention. Recurrence of otitis media and the prevention here. It's not about the treatment and how to choose the treatment and etc. Okay?
Because the doctor was like he didn't know, is it the right medication or not? He was hesitating.
I'm not hesitating. You didn't hear my question. I'm asking about what is the best option for her. It's an open question. So the best option is, we have a prescription for treatment for the moment. We can use it. Yes, we can use it. And we need a prophylaxis. What kind of prophylaxis? So and so. That's it. Okay. I didn't answer. Okay. I didn't say anything.
Yeah. But if you see, he had a failure. He had a failure of treatment within 9 days, right?
9 days.
No.
More than 9 days?
Who said that?
If he had a failure within 9 days, they use ceftriaxone.
It's not a failure of treatment. No. It's recurrence.
It's a recurrent, my dear. There is no failure. It's a recurrent. It's not failure. It's a recurrent.
And clarithromycin?
Then recurrent.
It was prescribed. Check.
It was prescribed and say like 3 months ago, and it's a recurrent. There is no failure.
Okay, I thought the clarithromycin since 10 days ago.
10 days? No, it's not 10 days. It's 3 months ago, I believe.
Okay.
Right? Okay.
Thank you.
Okay. مكتوب والله ديسمبر اهو. ماشي.
بس عشان مكتوبة ب 10 أيام فأنا فكرت إنه هي إذا 10 أيام
No, the period of treatment is for 10 days, not since day for 10 days. For 10 days. Okay. And the prescription was dated.
لو كانت 10 أيام كان بنعطي ceftriaxone صح؟
No, my dear. Deal with the do not try to manipulate the case. Deal with the case as per you ask your questions and the answers you're getting. Don't tell him, no, we're not gonna do that. We're gonna go for ceftriaxone. Again, you didn't solve anything. Still, it's totally like, it's not gonna get it. If you change it as the way you said, you're not gonna get fully solve it, because the other parts of the case, this guy is like recurrent. So we have to do something for this recurrence.
No, okay? I mean, in addition to the prophylaxis. Okay, it's okay. I got it. I thought it's
guys, let's proceed, please. Yeah, proceed, please. Yeah, okay. يلا, let's go. Station 4.
Station 4 أنا مش فاكر إيه بالظبط. فكوني scroll down for a second. 1 second.
Let me zone on.
Okay, no problem. Okay, good.
دي سهلة
ماشي
بقى، يبقى
ماشي.
سعيد الحظ بقى، سعيد الحظ اللي ياخد اللي جاية دي.
هنتخانق عليها دي شكلنا.
Who's lucky? Next one is like
Okay.
it's not very easy, but it's not complicated.
كارين ديفيد إهداء.
يا
ديفيد
دكتور.
يلا يا ديفيد.
ديفيد ده
يلا يا
صاحب
عم.
أرميا، أنت صاحب أرميا؟
أكيد.
صاحب ارمي يس.
فين
هو
أرميا؟
أرميا لو ما جاش بيسيب جاسوس كده فهو أكيد.
بالظبط.
ما بيعديش حاجة بالسهل. يلا بينا يا ديب.
أرميا لسه في مصر؟
ارميا لسه في مصر.
قاعد يتصور على الفيسبوك.
شكله هيحضر رمضان في مصر. ما بيصومش هنا رمضان.
ما بيصومش رمضان هنا طويل، لما بيصومش
بس رمضان في كندا.
ايوه.
يلا بينا طيب. يلا بينا يا ديب.
اوكي
ماشي يا صديقي.
ثانية واحدة. ستيشن يس ستيشن 4. one moment.
ديفيد انت اشتغلت في صيدلية؟ طب خلاص يعني ان شاء الله تفهمني بقى. ماشي يلا.
I think we don't have, sorry guys, we don't have station, we don't have reference here, right?
We don't have reference, yes.
Yeah, no reference here يا ديفيد. يلا يا عم ريح نفسك وريحنا معاك وحلها وخلصنا. ديفيد اخوه صيدلي زميل على فكرة، مش انت اخوك صيدلي برضه هنا في كيبيك صح؟ صح. وديفيد ان شاء الله يبقى صيدلي زميل برضه في كيبيك. طيب ثانية واحدة.
So there's no reference for this one, right?
Yeah, no reference. So we're gonna start right away. Let's go. Hey.
Hello, may I speak to the pharmacist?
Yes. Hi, my name is David. I'm the pharmacist today.
Okay, we have Oh, hi, how are you? So we have Anthony here. He's 51 years old. I give him prednisone 50 milligrams once daily for 5 days for his exacerbation of asthma. Frankly speaking, I don't know what to do with this fella. I want you to talk to him, or you can advise me what to do if there's any kind of changes or manipulation in his medical profile, medication profile, so we can to help him to decrease the exacerbation of asthma.
Sure. For COPD, asthma or COPD?
He's not COPD patient. He's an asthmatic patient.
Okay, sure. I can help you with that. Please have a seat. And okay, his name is Anthony. He's 51 years old.
Yes. He comes to the emerge. Yeah, he comes to the emerge like couple times with the exacerbation of asthma.
Okay. Okay. Can I see his profile?
Definitely.
Okay. I see in his profile he's taking methadone.
Yeah, he's a drug addict actually.
Okay. He takes his methadone regularly?
Every day.
Every day, even he was with his exacerbation?
Definitely, yes. We cannot stop it, right?
Yes, that's right. Okay. And his Ventolin?
He has Ventolin and Flovent on hand.
Okay.
Yeah, we usually take it every month.
Every month. Yes. He's taking it regularly?
Yeah, regularly. Sometimes he skips doses of Flovent, but we counseled him on how to use it lately.
As you know, Doctor, Flovent is very important to keep the patient stabilized, especially the patient have recurrent exacerbation.
Yeah. Okay. We like he's like now committed to take it on a regular basis.
Okay. How often he take his Ventolin?
He takes when needed actually, but lately he keep taking it like very frequent. Sometimes he take it very frequent, sometimes he doesn't take it at all. I'm not sure what's happening with him.
Okay. And his Flovent is not adhering?
Sometimes no, but we counseled him lately on this one as well.
Okay. Okay. Is the methadone, is he have any sign of symptoms of methadone overdose?
No signs of symptoms of methadone overdose.
I suspect that the patient have. Is he taking? Are you sure that he is taking not any drug, street drug?
Definitely, he takes street drugs. He's a drug addict. Sometimes he takes street drugs.
Okay, maybe he's taking street drug with the methadone cause overdose medication for.
He never overdosed. He didn't tell me that he were overdosed.
He never overdosed. Okay. He doesn't have any sign of the overdose, like increase in his blood pressure, increase in heart rate.
No increase in blood pressure and heart rate. His heart rate and blood pressure is good. Are good.
Okay. Maybe because he is not adherent for fluticasone, make the exacerbation.
The last time he told me that he was that was in the beginning, but the last time he told me that he is like he's adherent to it, he's committed to it. But he's got to admit it like today in the morning. So I give him prednisone as well, 50 milligrams once daily. But I'm not sure if we can change any of his medication of his medication or something to can decrease the risk of having these episodes.
Maybe we increase the dose of fluticasone.
Increase the dose of 250. It's 250, I believe, is the maximum we can get. No.
Okay.
I just want to make sure that I just want to know that what we can do, like changes in his medication, or we can help him to decrease, or what is the reason for this happens.
Okay. Recently, he is adherent to fluticasone.
Yes.
Okay. And when the last time he takes
1 minute remaining. 1 minute.
When he takes the prednisolone last time, it was control his symptoms?
Yeah, it was controlling the symptoms, but he admitted back.
I think fluticasone need to be increased.
Need to be increased?
Yes.
Okay, like what's the strength?
500.
Whatever you tell me, I will recommend it. No problem. Just give me a recommendation. I will write a prescription for it.
Dose of corticosteroid, we can increase it to medium dose, and if needed, we can increase it to high dose. Fluticasone.
Okay.
Yes. From 200, maybe for 400, increase the dose, and if it's needed, we can increase also, and we can also try to add if it doesn't control his symptoms, we can add something like just we need to increase the dose of fluticasone because this is low dose.
Time is up.
And the patient needs to be adhere on fluticasone. It's very important.
ممكن احاول اعملها معاكم؟
يلا بينا.
طب بص، خلينا نحلها احسن مع بعض، وخليك انت الستيشن الجاي يا دكتوره. دكتوره
خلي نورة يا عم، شكلها هتحلها. نورة شكلها هتحلها.
نورة بنت بلدي.
يا
طيب
شكلها خبرة كده
عشان لسه في 2 ستيشنز بس عشان ما نطولش.
طب هنعملها بسرعة.
لا
شغالة في صيدلية؟ شفتي الفيزياء قبل كده صح؟
لا صراحة لا، بس يعني أنا عندي فكرة، معرفش الفكرة في دماغي صح ولا لا، بس يعني قلت أجرب. أوكي
هي صح.
أوكي
يا
رب. أوكي
يلا بسرعة.
Hi, I am Noor, the pharmacist. How may I help you?
Hi, my name is Mohammed. I'm the resident here. We have a patient. His name is Anthony Queen, and he is usually admitted for like asthma exacerbation. And I want to know if there is any reason for this or any change we can do to decrease his admission for asthma exacerbation.
Yeah, of course. I will address your concern, doctor. Could you have a seat, please?
Yes, for sure.
So the patient is Anthony. How old is he?
51 years.
51 years old. And does he suffer from any allergy?
No allergy, actually.
No allergy. And I can see here from his profile that he is taking methadone. Does he take it as prescribed?
Yes, every day.
Also, I can see that he is taking Ventolin and the Flovent. Does he take it as prescribed also?
Yes.
Okay. Does he miss any doses of the Flovent?
In the past, he used to miss doses of Flovent, but we counseled him on it, and he was committed to it. He told me that he is recently like taking his buffers as per prescribed.
And
but still he got admitted for asthma exacerbation, and I give him a prescription for prednisone 50 milligram once daily for 5 days.
So is there any change recently in his lifestyle, doctor?
His lifestyle, actually, he's a drug addict, you know. So it's recently he's like in bad mood, and he was taking lots of alcohol.
Lots of alcohol. Okay, that's it. Okay. Did he change his home? Went to another place or anything new in his life?
He went homeless actually recently.
Yeah.
And he's in that situation. Yeah.
Yeah. Okay. So, and you prescribed for him prednisone 50 milligram to be taken for 5 days. That's correct?
Yes.
Okay. So actually, doctor, here I can see that the patient is not like stabilized on Flovent. So in this case, we may like add another medication with the Flovent, and I recommend here for you like using budesonide formoterol. It's like a corticosteroid medication with a long-acting bronchodilator. So both of these medications like in one inhaler, and it could prevent him from having any more exacerbation, because the patient here, I can see that the patient here is not stabilized in this dose. So we can go in the above in the higher level and add another medication for him. So are you okay with that, doctor?
Yes, I'm definitely okay with any of your recommendation. Any recommendation that you would give as well?
Okay, so this is my main recommendation right now. And also, does he take any? So you told me he's taking recreational drugs. Is correct?
Yes.
Okay, so also maybe like he's taking like cannabis or anything like that. So
maybe.
If he takes, so if he taking anything like that, it also may exacerbate his asthma, because like smoking cannabis also can exacerbate his asthma. So if you could advise him not to like smoke cannabis, but because it will do like a bad effect on his lifestyle.
Actually, I believe he told me that he started using street drugs like opioids. So anything we can exchange in his medical condition to decrease his use or something.
Okay, so he is not taking any aspirin or any over-the-counter medication also?
No, he doesn't have money for this, no.
Okay, so maybe yes, actually also taking like opioids also with him can exacerbate his condition here. So it's very important for him to be away from all of these recreational drugs, because also it's exacerbate his condition. Okay, so did I address your concern, doctor?
Yeah, thank you so much.
Okay, thank you.
ماشي يا شباب. طيب في
هو الميثادون تقريبا ال 80 دي مش المينتنانس دوز، المفروض يرفع الميثادون شويه صح؟
لا يا عم، انت يرفع الميثادون وهو عنده ازمه عايز تموته؟ حرام عليك.
صح.
طبعا. بص في كلمه اتقالت بقى، صفا said a very nice thing. Alcohol with methadone will cause him respiratory depression، وده اللي بيحصل. كل ما الراجل ده يشرب الكحول، انا قلت ده هو بيشرب الكحول كتير. No, we cannot stop methadone. No. وبياخد اوبيويد. طيب اوبيويد مع اوبيويد الميثادون ده بيعمل له ايه؟ بيحطه في ريسك اوف ريسبيراتوري ديبريشن، فبيخش على طول على ازماتيك اكسسربيشن، يقوم داخل الهوسبيتال. تمام؟ فهنقوم عاملين ايه؟
انا كنت داخل في الموضوع ده كنت خلاص اخش.
Exactly. So the best option here, yes, I agree that you guys want to increase the corticosteroid and everything, but this is not the root cause of the situation. The root cause of the situation حاجتين. We're gonna switch it methadone to Suboxone. اوكي؟ ليه بقى to Suboxone؟ عشان لو اخد اوبيويد هيحس بويزدرول. فالاوبيويد مش هيزود الريسبيراتوري ديبريشن افكت اوف ذا ميثادون. اوكي؟ ده رقم واحد. ده رقم اثنين، اديله ناركان كيت بس خلاص عشان ما يموتش. تمام؟ هو ده الحل للموضوع. قلنا لك جون صفا حلتها، لو صفا كانت دخلت في البتاع ده كانت حلتها. اديله
والله انا كنت انت ما سبتنيش انت.
Yeah, that's why I asked you. Do you work in a hospital like pharmacy setting? I thought that you saw this before. Seriously.
Yes.
Yeah.
اللي عاش الارمي يا عم، اللي عاش الارمي.
Yeah. So methadone, it's like it's a very obvious, guys. It's a very like. Yes, we switch. We recommend to switch to Suboxone, okay, and give Narcan. That's it. By the way, people who have COPD and asthma are contraindicated with methadone. By the way, I'm not sure if you guys know this or no, because it has no ceiling effect. Methadone has no ceiling effect. What does it mean? When you increase the dose, the respiratory depression risk will increase with no limit. Okay, Suboxone has a ceiling effect. The maximum dose you can give is 20, 24, or 36, something like this. Okay, above that there is no effect. Tamam? So that's the solution of the situation. Yes, we're gonna dispense prednisone. That's fine, because he has like exacerbated asthma. But again, he's drinking alcohol. The guy is homeless. He's exposed to opioids. Let's play it safe and switch methadone to Suboxone and give him Narcan kit. That's it. As simple as that. Okay.
انا سالتك قلت له عنده ريسبيراتوري ديبريشن، فانت قلت لي لا تقريبا.
لا يا عمي، ما هو داخل اصلا بريسبيراتوري ديبريشن في ازمه اكسسربيشن. لا طبعا. ماشي يا عم نيف. I think Safa got it, by the way. She wrote the answer. Yeah. Okay. So what else? We have 2 more stations, I believe, Master.
Wallah, we have. Any participants?
I would go for it.
With pleasure, my dear. What's your name?
My name is Maisa.
My name is Maisa.
Yeah.
مصرية عراقية.
No, I'm Lebanese, لبنانية.
لبنانية.
أشطر ناس اللبنانية.
واو, thanks.
في التجارة. طب يا ميسة عشان انت شاطرة هنديك 2 ريفرنس.
يلا. 2 ريفرنس.
البتاعة دي فيها 2 ريفرنس. اوكي؟
يا اوكي.
محظوظة يا ميسة. انت يعني انت تشوفي عايزة تحتاجي ايه، ممكن ما تحتاجيش ال2.
اوكي.
بس ممكن تحتاجي واحد فيهم زي ما انت عايزة. براحتك خالص.
Okay, I'll take care of the timing in 30 seconds, okay?
Okay.
Yes, sure.
Okay, let's start with that.
One moment. There you go.
Yeah.
So you have 2 references, station 5 and station 5.2. Pause. What about
station 5?
Station 4,
okay.
Please post it here. No reference to station 4. هو معانا ده ولا ايه؟ وفاء انت معانا؟
Yes, I'm with you.
وفاء.
I'm sorry.
Yeah, I heard it, yes.
ايوه سامعاها بس عايزاها يعني تنزل واتساب، عايزه ارجع لها تاني. كانت فظيعه.
لا مفيش، ما ستيشن 4 ما كانش فيها ريفرنس.
طيب خلاص تمام يلا.
Okay. Station 5, okay? You will have 30 seconds. We can give you up to 60 seconds because you have 2 stations. You have 2 references. ولا خليهم 45 سنة. ماشي يا جزولي، جاهز؟
Okay, no problem.
45 seconds.
Okay.
Yeah, you can start now.
Okay. So hello, I'm Maisa, the pharmacist. How can I help you?
Yes, hi. I'm a specialized nurse here in the hospital.
Yeah, for sure. You're welcome. Please, may I know your name?
Yeah, my name is Jennifer.
Excuse me?
Okay. Yes, I'm asking about one of the patients. She was just diagnosed with migraine. Okay.
Okay.
Yeah.
Yeah.
And I would like to prescribe here the rizatriptan.
Okay.
Okay, so I would like to know if this would be the best option to hear or no.
Okay. First, I need to get some information about the patient.
Yeah.
So I can see on the profile, she's Halawetha Hassan. Okay, she's 39 years old.
Yeah.
Okay, so I see she's taken Marvelon.
Yes,
and
exactly.
and Ventolin and Flovent. Is it for asthma or COPD?
It's for asthma.
Okay, and is she controlled? Do you know if she's controlled?
A little bit, yeah. We can sometimes and sometimes. We got some excessive patients from every now and then.
Okay, and I see she's taken Ramipril. Is it for blood pressure?
Yeah.
Okay. Is she pregnant or breastfeeding?
No, I don't think so.
Okay. First, you tell me you want something for her migraine, and you are considering what exactly?
What exactly? We're considering rizatriptan, Maxal.
Yeah. So, did she use anything before for her migraine?
No, as I told you, it's just she has just been diagnosed with that today.
Okay. Okay, perfect. So, some question about her lifestyle. What does trigger exactly her migraine? Do you know? Is it about diet or smoking, alcohol?
I think maybe smoking. Maybe.
Okay. Okay. Perfect. Let me check my reference for a few minutes. Do you have any other concern or question?
No, it's only for that. Rizatriptan, and I would think, yes, I would like to prescribe any of the triptans.
Okay, I get it.
Most effective, yeah. Okay, go ahead.
Yeah. Okay, so just a few minutes to check my reference. So is she her blood pressure controlled? I didn't ask about it.
What is
because
it?
actually this drug is contraindicated in patients who have uncontrolled hypertension or severe hypertension.
Her blood pressure, it's well controlled only with the Ramipril.
Okay. Okay.
Yeah, last reading was about 125 over 92.
125 or 92, yeah, okay. Okay. And so she's taking Marvelon.
Excuse me?
Yeah, so she's taking Marvelon.
Yeah, like an contraception.
Yeah.
Ventolin, Flovent as well.
Yeah.
Any contraindication with the Flovent, with the rizatriptan?
Yeah, I'm just checking, just a few minutes. So actually, I don't see there is a
minutes
problem if she's
remaining.
taken. I
minutes
don't see there is a problem if she will take triptan, but there is a
How many per day? How many
yeah.
tabs?
But the point is that I was checking that because she's taken
2 minutes
Marvelon.
left.
Yeah.
2 minutes left.
Okay. Yes. Yeah, I was asking about the dose. How many taps per day?
I was just saying that because she's taking estrogen and she's having migraine, she's at risk of having a stroke. So what are you asking me? I'm sorry.
The dose.
Okay, so the dose is 5 milligram. She can go for maximum dose of 10 milligram.
Okay.
And it comes in wafers. So she will be taking the first dose, and those should be separated by at least 2 hours. And yes, she cannot take more than 2 hours and more than 2 doses in one day, in 24-hour period. Okay, so if she took the first dose and she didn't feel better, she don't take the other dose. So she will just take the other dose if she felt some improvement on the first dose. Okay.
Yes. Okay.
Yeah.
No problem. Okay. Thank you so much. I'll give you a prescription for that. Yeah. Thank you.
Okay, thanks.
Turn it up.
Okay. Good. Hmm?
You can do it.
Who can do it?
You.
Go ahead. شباب ما حدش يكتب في البتاعة دي بعد اذنكم يعني ما ينفعش نسأل كده ما ينفعش نحل الستيشن وزميلكم لسه بيتكلم بعد اذنكم بس لو تسمحوا لي. Okay, no problem. Anyhow, so okay, let's do the assessment. What do you think? Let's do the assessment or you want to retake it? أحمد صالح رافع ايدك عايز ايه؟
لا انا رافعها من الستيشن اللي فاتت والله بس نزلتهاش.
عملت اصلا؟
في محمد عبد السلام وفي ايفون. They were eager about it. So let's try one of them.
Okay. You want to do the assessment, guys, or retake the station? This is a question.
You do it. Muhammad will do it.
Assessment.
Assessment. ماشي. As you wish.
قفلتها يا باشا.
As you wish.
نور قالت assessment.
assessment خلاص يبقى assessment.
هي اللي ضحكت كده صح؟
خلاص نور قالت assessment so it's an assessment.
طيب let's do the assessment, no problem. Okay, what's the problem here?
Kind of migraine.
What about the assessment? No, the assessment of our colleague. Was it sufficient or no?
No, not sufficient.
Okay, I showed you two references, right?
Yes.
One for the rizatriptan, the other one was for
the side effect of oral contraceptive.
Yes, exactly. So what does it mean? This would indicate anything. Why I shared you the contraception?
Migraine with aura or more than 15 cigarettes.
Exactly. Simply speaking. Okay. Okay. So here we have you have to check. So I shared you the contraception, like an article about the contraception, combined hormonal contraception here, right? So this is the point. You have to check. You have to dig in. ايه المشكلة هنا بالظبط؟ في حاجة، في أكيد في حاجة غلط، ما دام أنا أعمل لك كده يبقى في حاجة هنا. أنا مش جاي، أنا جاي لك عشان ريزا تريبتان، عشان لو هتعملي كونسلنج تعملي الطريقة اللي أنت عملتي بيها دي بالظبط. أوكي، زي طعم كده يعني. تمام؟ فبس أنت رحتي ورا الطعم وخدت الريزا تريبتان وعملتي الكونسلنج عادي جدا جدا جدا. بينما هنا you have to check. She's taking Marvelon and she was just diagnosed with migraine. What is the symptoms? You can ask, what is the symptoms of the migraine exactly? Is it only headache or there is any other neurological involvement or implications? Like عندها بقى مشكلة في السبيكينج، في السبيتش، ولا بيحصل لها vision disturbance, blurred vision, anything that indicates it's like a migraine with aura. Is it migraine with aura or no? Okay, so migraine, only migraine, we can give the contraception, right? We can give only...
But she is a smoker. It depends how many cigarettes she is in, and she is over 65.
Is there another point? She's older than 35 and she smokes.
How many cigarettes per day? Yes.
Yes, exactly كده. Okay, how many cigarettes per day? عندها aura ولا ما عندهاش aura? She's taken combined hormonal contraceptive. So this is the point here. The problem is in the contraception. So you have to rectify this problem first. If it's with aura, we have to stop it. What we can do with the hormonal contraception? Should she stop taking the contraceptions or what?
She
If
can
she
take
was diagnosed with aura.
Yeah, I think she should start.
Non-hormonal.
She can switch it to different form. Yeah, progesterone only.
Switch it to what?
Progesterone?
Switch to different contraception.
Like what?
Like progesterone.
Yes, she can take progesterone only contraceptives. Okay? She can take only progesterone only contraceptives. This is number one. Smoking as well, you can advise, because what I told you, you asked me about what? The triggers. Okay? Was it triggered by what reason? I told you usually I think it's getting triggered by smoking. Okay? هنا السجاير كمان بتعمل لها triggering للسايد افكت بتاع الميجرين معلش. So this is another point. تمام؟ So the assessment should be, I think, should be more comprehensive than that. You should ask. This is the hospital setting, guys, as we say. In the hospital setting, feel free to go in depth with diagnosis, with symptoms, with the specific measures. What about the blood pressures and etc., kidney liver functions, everything. Okay, everything of relevancy here. If you find it relevant, go and ask about it. Okay, so here, what about the symptoms exactly? Only headaches? Is there any neurological implications or no? That's it. ماشي، واسأل بقى وادخل اسأل واحدة واحدة كده والسجاير وبتاع، بس هتلاقي نفسك وصلت للحل في الآخر. تمام؟ Okay, for me I found it like everything was good, but except your assessment. Your assessment wasn't good. Wasn't sufficient for me. Okay? تمام يا دكتورة؟
Yes, thank you.
ماشي يا دكتورة ميس. بس يعني خلاص، هي الكيسة برضو يعني مش صعبة بس مش سهلة برضو. يعني بقى خلي بالك دايما من الريفرنس اللي هو بيجي يعني.
ماشي. لو guys for the module of اسمه ايه اللي احنا كنا بنتكلم عنه health promotion. تمام. health promotion here you can tackle a health promotion module, like for example offer smoking cessation, ask her because she's taking Ventolin and Flovent, and you can ask about the vaccination, all this, like, you know. So it's all these points I believe count in this station as well. Okay.
Yes.
تمام.
Okay.
Doctor, I have a quick question. So what was the solution in this case? Is it that she should take the rizatriptan but stop the contraception, right?
If there is any problem with the rizatriptan? No, it's not the rizatriptan's problem here. She can take rizatriptan. Her blood pressure is well controlled. There is no problem in that. Okay? It's well controlled. Yeah, but the problem here is with this one, with this guy, the Marvelon.
But what about the
and about the cigarettes as well, and the smoking as well. She smokes, and she got triggered by smoking. Okay.
What about asthma and the chest pain side effect?
No, there's no contraindication or something. No.
Okay.
It's not a contraindication. It's one of the side effects that could happen. Chest discomfort with the treatment. Okay. اوكي. دي كانت الكيس بتاعت حلاوتها ام حسن.
مش سهلة برضه يا اخي.
حلاوتها ام حسن لا مش سهلة.
مش سهلة برضه. ستيشن نمبر 6. بتقولي ستيشن نمبر 6 اللي فكرنا كده يا ريس.
ستيشن ليه نعملها انا طيب عشان انت مش هتفتكر.
لا مش فاكر بصراحة.
طيب يلا بينا. ستيشن نمبر 6.
Can I be the pharmacist?
You can be the pharmacist?
or already
the actor?
ماشي. She
be the actor?
No, she can be the pharmacist. ليه actor ليه؟
مفيش هو الطبيعي ان انت هتبقى الفارماسيست. No problem, okay. Go ahead. Who are you? Sorry, who are you?
I'm Safa.
صفا انت عملتي معانا مش كده؟
Yes.
Okay.
Can I do again or not?
والله لو حد من الزملاء عايز يدخل يبقى هيبقى له الأولوية صفا. مفيش يبقى انت طبعا.
ممكن انا اخدها؟
انت مين؟ يا احمد يا صالح.
احمد صالح يا عم. لا انت مش عارف احمد صالح.
صح. هو ما دخلش معانا احمد صالح صح؟
لا خالص.
لا لسه المرة دي
لسه ده اول مرة ده.
انت منين يا احمد يا صالح؟
اسكندريه.
اسكندريه. طب اديله 2 بقى. ده اسكندراني ده بلدياتنا ده.
الحوار ده بيتكرر كل اسبوع على
فكره. اللي بعديها
هجيب لك الستيشن مخصوص اللي احنا شايلينه مره.
اللي شايلها على جنب بقى. الرهوان الثاني.
ايوه هات الرهوان الثاني بقى.
اديله الرهوان الثاني يا محمد.
استنى اجيب لك واحده من المستخبيين بقى. اوعى تقول لي بقى من سان ستيفانو ولا لوران ولا حاجه كده.
لا من
لا ورا شويه عند سيدي بشر.
اوب فين في سيدي بشر؟ هناك من هناك. ده
انا اقول لك انت فين. انت عند انت جنبي عند الاكاديميه.
ايه ده؟ انت جاري ولا ايه بجد؟ انا هناك.
ايوه يا عم الحوار ده حصل المره اللي فاتت والله.
ايه ده احنا اتكلمنا في نفس الاسئله دي؟
فعلا
يا نهار اسود العظيم.
ده انا الزهايمر قتلني.
وعزمنا عليك برضه بالستيشن مخصوص وبتاع.
وخدت بس الرهوان كان الاصلي بقى.
افتكرت الحوار ده. ايوه افتكرت الحوار ده.
الدرجه دي ناسيين ولا ايه؟
ناسيين يا عم. اعملها يا عم كل يومين يا عم السيشنز دي عشان مش فاكر حاجه.
اوكي يلا ابو حميد.
يلا بينا.
همسك لك التايمر.
اوكي التايم يا جازولي.
يلا بينا.
خلاص اديله ساعة ونص يقرا الريفرنس.
ساعة ونص يقرا الريفرنس.
يلا معاك. استنى، ما عملتش شير للريفرنس اصلا. ثانية واحدة.
يلا يا احمد باشا.
لسه ما وصلنيش حاجه. اوكي.
وصل؟
اوكي وصل تمام.
Okay. It's like an
trial.
A trial, yeah, something like that. Okay, my friend.
يلا بينا.
Gazouly, what?
Yeah, it's okay. You have 30 minutes, it's fine. 30 seconds, sorry.
Yes.
ماشي يلا محمد.
Yes, hi.
Hi, this is Ahmed, the pharmacist. How may I help you today?
Yes, hi, my friend. Thank you so much. I'm the family doctor here. Okay. And I'm a little bit concerned about one of the patients, الحاج أحمد.
ده مش أنا أكيد.
No, it's not you. Okay, so الحاج Ahmed, like, he told me that he's suffering from like hypotension most of the time.
Okay.
Yeah, I believe it's because of the tamsulosin that he's taken. I was thinking about to change it to Cialis, maybe.
Okay.
Tadalafil, yeah, but I know can he take the tadalafil with other medications, or no? I don't know.
Okay, so in order to give you the best or the most appropriate medication that suits the case of Al-Hajj Ahmed, I would like to ask you a couple of questions regarding his profile.
Yeah.
Okay, so can I know what are the medical conditions that Al-Hajj Ahmed has?
Ahmed has hypothyroidism. Okay, and had the prostatic hyperplasia and some anxiety and etc.
Okay, and I see here from his profile that he's taking for the hypothyroidism the levothyroxine.
Yeah, Centroid, yeah.
And he's taking clonazepam in the morning and one at the supper time, right?
Yeah, exactly.
Yeah, for which reason he's taking the clonazepam?
Anxiety, insomnia, and anxiety.
Okay, and he's taking the tamsulosin.
Yes.
And he is taking the venlafaxine and quetiapine for the same purpose, for the depression, or for which reason?
Yes, depression. Yeah.
Okay. Also, I would like to ask you if he's taking any other. I believe he's taking the bisacodil and vitamins as a supplements.
Yes.
Okay. Yes. And I would like also to ask you a couple of questions regarding his lifestyle that might affect our decision. Is he a smoker?
Not so. He smokes about 5 cigarettes per day.
Okay. And does he drink any alcohol?
No.
Okay. And is he exercising or not?
Exercising, yeah, sometimes.
Okay. And what about his diet?
I don't know. I have no idea about it.
Okay. Okay. So your comment was regarding the tamsulosin that you feel that it is reducing his blood pressure.
Yes.
And you would like to transfer or to change the tamsulosin into tadalafil, right?
Correct.
Okay, so I'd like to check my reference to see the appropriateness of the tamsulosin and its effect on the blood pressure of the patient. and to check what are the other alternatives available.
Excuse me, would you repeat that?
I would like to check my reference to check the appropriateness of changing the tamsulosin into tadalafil.
Yes, okay, go ahead.
Okay, just a second. Okay, so is there any other side effects he's seeing with the tamsulosin, or only just the blood pressure?
It's only the lower blood pressure. He told me that most of the time he's hypotensive, and he got like increased risk of falling.
Okay.
It's not a good reason to change. I don't know.
Of course, it's a good reason to change, but I'm just thinking what are the other alternatives, and what about his BBH? Is he in pain, or it's controlled?
We can say it's controlled.
Okay. Okay, so I believe my recommendation in this case, adding tadalafil is not going to improve his.
2 minutes left.
Sorry?
2 minutes left.
Okay, so based on the condition that we have here is the changing the tamsulosin and adding tadalafil, it might improve his symptoms a little bit, but it will remain having the same side effects because tadalafil as well as the tamsulosin, both of them are working in a similar way. So I do recommend, if we can, as long as he's in tamsulosin, we can change the tamsulosin into another group that doesn't have a big effect on the blood pressure, like the finasteride, to be taken as a 1 tablet per day as well, 5 milligram.
Finasteride?
Yeah.
Okay, the problem with finasteride is that the long time it takes to give an effect, about 6 months.
Yes,
right?
in this case, it takes a long time. So if he's unable to tolerate the tamsulosin to be taken in the morning, we can change it to be taken in the evening before sleep. By this, we can avoid the reduction in the blood pressure or the risk of fall that he might suffer from taking it in the early morning.
Okay, there's any other medication he takes that may aggravate the side effect of hypotension?
The clonazepam as well, it might do that, but
time is up. Time is up.
Okay.
Time is up, يا ابن بلدي. Okay. What do you think, my friends? Would you like to retake it?
Yes, I would like.
I would like to put that.
مين سلمى؟
No,
Laila.
Safa again.
صفاء يا صفاء.
Yeah.
طيب صفاء ولا سلمى؟ سلمى رفع ايديها برضه. تحيرين يا صفاء.
If Selma didn't practice like she can practice.
It's okay, Safa, you can go for it. I'm
No,
good.
no, you go.
ماشي يا سلمى.
Who is it?
سلمى speaking.
Who gonna take
Okay.
it? سلمى؟
اه
آخر كلام. طب يلا. سلمى أنت عربية؟
من مصر.
أهلا بيك يا بنت بلدي. طيب يلا بينا هنبتدي على طول. عندك الأسئلة؟ عندك قصدي الريفرنس؟ Okay. Okay, let's go. Hi, my name is Watson. I'm the family doctor here.
Hi, this is Salma, the pharmacist on duty. How may I help you, Dr. Watson?
Yes, Al-Haj Ahmed is one of my patients. He has a problem with the hypotension. He suffers from frequent hypotensive episodes that put him usually in the risk of increased falling. That's why I'm intending to switch the tamsulosin that he's taking to Cialis.
Okay, doctor.
5 milligrams.
So you suspecting like tamsulosin is a main cause for his hypotension episodes?
I think yes. According to my knowledge, yes, I believe. He takes other medications, but it's been like a long time he's taken them.
Okay, doctor. So can I ask you when this episode start?
Most of the time.
Okay, and anything has been a change recently related to this?
No, same situation.
Okay, so any new medication has been added to his regimen recently?
No, only tamsulosin since about 3 months ago. No.
Okay, so if you don't mind, let's go quickly over his profile. I see he's having here hypothyroidism and he's then levothyroxine 150 microgram on that. Is his control for this condition?
Yeah.
Okay, also I see he's taking clonazepam twice a day. And for what indication, if you don't mind?
He's taken for an anxiety.
Okay, and the tamsulosin for his BPH and LUTs associated with this, is this correct?
For what?
For his BPH, is the tamsulosin?
Yes, exactly.
Okay, and he's controlled under this condition? He's controlled under this medication?
Yes, it's controlled.
Okay.
Yeah.
Oh, I'm sorry. And he's taking also venlafaxine and quetiapine, as this is for what indication?
Thiamine, venlafaxine, it's for an anxiety.
On anxiety as well?
Yeah.
Okay, and his on bisacodyl 2 tablets and vitamin
For
D.
constipation.
Okay. So, okay, doctor. So I need 1 minute to check my reference, if you don't mind, to address your
Take your
concern.
time.
Do you have? Yeah, thank you.
No problem. Take your time.
Okay, so thank you, Dr. Watson, for patiently waiting for me. According to the reference, I have it here. It's an article, recent article about the effect of tamsulosin and other alpha blocker in the treatment of the BPH. And actually, the tamsulosin, it's one of it's a good medication to be used in this condition. So I believe as long as the patient is controlled under this condition, I would recommend to keep him on the tamsulosin. Okay, I would recommend to keep him on the tamsulosin. And I understand he's hypotensive, but I also have, I would like to highlight something here. He's taking clonazepam twice a day and his first pill, it's at 8 a.m. So this may be one of the reasons of his falls and getting dizzy. What do you think about that?
Okay, so can you give me the recommendation exactly? What is it? Because it cuts off. I don't know why.
Okay, so regarding your concern about the tamsulosin, I will not recommend you to change it. Keep him on this as long as his condition, the PPH is controlled.
Yes.
And for the clonazepam, you can either switch his morning pill to bedtime, or decrease his dosing during the day, but keep it at bedtime.
Okay.
Okay.
Keep it at bedtime.
Yeah.
Okay.
Okay.
What about the morning hypotension? That would help. I don't know, because as I told you, most of the time he got the hypotension. Yes. So it's not only at night, not only at the evening.
Time is up.
Okay.
Yeah, that's why. Okay, guys, have you checked the reference?
Serotonin.
Okay, what is it about? It's about what?
It's a study. It's a study between tamsulosin and the other alpha blocker.
بس
So
خلاص كده.
selective
هو
alpha
احنا
blockers do not
بنتكلم على
cause
ايه؟ هو انا بجيب لكم
hypotension.
ريفرنس ليه؟ معلش سؤال احنا بنجيب الريفرنس ليه؟ هو الريفرنس ده عشان يتوهنا ولا عشان نركنه على جنب ونحلق له ولا عشان نعمل ايه؟ تمام؟ اكيد عشان نبص فيه نعرف هو بيتكلم على ايه؟ توبيك ايه بالظبط؟ هو بيقول ايه؟ شايفين الريفرنس؟ safety and efficacy of ايه بقى؟ الثلاثه دول.
هختار التيلودوزين.
عندك ده وعندك ده وعندك ده.
Yeah.
احنا الكونسيرن عندنا ايه هنا؟ هايبوتنشن. يبقى ننزل نفر كده، كل ده لازمنا في حاجه؟ الهكس ده كله مش لازمنا في حاجه، صح؟ نبص هنا بيز لاين كاركترستيك مش عارف ايه، مش عايزينه في حاجه. نبص تحت كده اي بي اس ومش عارف ايه تمثلوسين، بيقارن هنا، بيقارن بين الثلاثه، صح؟ نشوف هنا بيتكلم على ايه بقى. كيو ماكس برضه مش عايزينه في حاجه، مش عايزينه في حاجه. هو ده بقى اللي احنا عايزينه. adverse effects to tamsulosin الفوزوسين وسيدولوزين، صح؟ دول الثلاثه اللي احنا عايزينهم. فين بقى؟ اهو orthostatic hypotension. Okay. What about the incidence here? بص هنا على واحد فيهم مين؟ تمثلوس. تك 3 2 3. هنا 0 0 1. هنا 7 1 0 0. يبقى هنا اللي بيدي 0 بعد ويك 1 و0 بعد ويك 2 بعد ويك 4 قصدي، هو مين؟ الفوزوس. ماشي. ده الريسك بتاعه قليل يا دكتورة في اللي هو بيعمل ايه؟ ما بيعملش hypotension. Sorry guys, I'm speaking in Arabic. I'm so sorry. So here we are comparing about the three medications, three molecules that we have of the same category, same family therapeutic class, right? So we are differentiating about our concern here. We are concerned about the orthostatic hypotension. So here you have the figures, the incidence with each one, with each agent, okay? So what do you think? The safest one would be alfazocin. Yes, alfazocin. This is the safest one.
السيلودوسن ولا اللي هي الالفازوسن؟ مش السيلودوسن احسن كسلكتيف؟
انا على الاثنين بص
if you read the conclusion it says it all. If you read the conclusion it says here psilocybin the most effective تمام alpha 1 blocker with rapid onset of action. تمام. بس when it comes to however psilocybin the last line has more adverse event in the form of abnormal ejaculation and dizziness when compared to tamsulosin and alfazocin. So alfazocin here is the most safest.
Yes, because I'm talking about that now both tamsulosin and psilocybin are the only one which are selective. Okay, but alfazocin is not selective anymore.
As you like, it doesn't matter here. What really counts here is your side effect. Your
side effect, that's the main concern here.
Yes,
the main concern.
I agree, but because I'm talking about the orthostatic hypotension and the risk of falls, so that's why I'm going to the selective more than the non-selective.
The one selective. Yeah, but for me it doesn't matter. But alphozocin is not selective.
No, it's
not
now selected
anymore.
in the CTC.
Yeah, it was selective, right? But it was changed or what?
Yes, it's a change.
Yeah, they changed it.
يا راجل.
Really?
لسه recently. ده قريب من كام شهر.
ده لسه هما الثلاثة دول دايما كانوا يقول لك هما الثلاثة دول السلكتيف. Okay.
خلاص بقوا اتنين بس.
Anyhow, alphozocin actually has a lower incidence of hypotension than the tamsulosin, and it's in real life. By the way, guys, this is a real life station. Okay, so a real life situation في البراكتس فعلا يعني. اوكي، وكان فعلا حسب الريفرنس بقى اللي موجود في الصيدليه اللي هو RX Vigilance، هتلاقي اغلبكم عارفه، بيقارن الثلاثه. لما بتقارن الثلاثه بتلاقي فعلا الاثنين دول اقل بكتير في الانسنس. ده في الهايبوتنشن بيبقى الانسنس بتاعه up to 20%. Up to 20% of the patients get the orthostatic hypotension, whereas with the other two molecules, with the alphozocin, as much as I remember, it would be only 1%. With pseudolocin, it was 0.5 to 1% or something like that. Okay? فالاثنين دول أقل بكتير في الهايبوتنشن.
Dr. Rees, what about the additive hypotensive effect of both the alpha blocker and the quetiapine?
كده it could happen طبعا. طبعا it could happen. ده ممكن يحصل طبعا، بس هو هي سألتني سؤال حلو، في حاجة اتغيرت في الآخر أنا مش عارف إيه، قلت لها لا، أنا بياخد كل الأدوية مفيش بس غير ده، وده لما دخلناه هو اللي عمل مشكلة.
Yes. Shall my recommendation in this case to start the psilocybin at low dose and titrate it more slowly and to be taken at the night time and don't change the position to be in the supine position for about a long time.
Okay. هو بيحتاج titration. الثلاثة على فكرة بيحتاجوا titration.
Yes, I mean more delayed titration, to be slowly titration because of the hypotension, because it's recommended in the monograph.
No problem. طبعا مفيش مشكلة.
كوتابين
طبعا هو مشكلته كمان اللي بياخد ايه، انا سألت في حد من الزملاء مش عارف سألت سلمى ولا ميسن، قلت لها بالظبط في حاجة تانية ممكن تعمل مشاكل هنا، تلاقي عندك كلونازيبام وما تلاقي عندك كيتايابين.
Yes, because quetiapine itself is alpha blocker.
بالظبط، بيشتغل على الادرينرجيك بلوكرز برضه. مظبوط، الكلام ده صح. تمام. كلونازيبام ليه انتي كولينرجيك على فكرة سايد افكت برضه. كلونازيبام ليه انتي كولينرجيك سايد افكت، وده برضه كمان بيزود الريسك اوف فول.
And shall we refer the patient to the occupational therapist?
ولا ريفير ولا بتاع، هو ده فاميلي دكتور، خلاص غير رئيسي، غير خلاص ذاتس ات، وابتدي واشتغل وتايتريت وشوف. انت معاك الايفيدنس، انت بتدور على معلومه معينه هنا، هو بيميجر هنا الكومبتنس بتاعتك هنا في الحاجات اللي بتبقى زي دي، ان هو انت الريفرنس تشيكينج بيسموها، مش عارف getting scientific information from reference، حاجه كده. one of the skills, it's one of the competencies. ان انت تشوف الريفرنس وبتدور على المعلومه بالطريقه اللي بتشوف بالظبط الريفرنس انت عايز تطلع ايه.
What I mean for
اتفضل.
What I mean for the risk of falls to be referred to occupational therapist.
ليه؟
Because he will continue on the same medications, alpha blockers.
لو فضل الكلام ده، هو ما وقعش لسه، هو بيجيله بس هو increase risk of falls. لو حصل وفضل مع الدواء الجديد الشكل ده، ساعتها ريفير، مفيش مشكله، ممكن تريفير. بس هو خلاص انت ممكن بتجرب الدواء وبتشوف هيشتغل ولا لا، هل هيقلل الريسك ده بتاع الهايبوتنشن ولا لا.
اوكي.
ليه ما نروحش بقى مع الجماعه الفيناستريد والحاجات دي؟
Because it takes long time from 6 to 12 months to start its effect. and it's related to the prostate size itself. It must be more than 40 or more milli. This should be mentioned in the case, or we should assess this first.
And also finasteride. Finasteride will not treat the symptoms that the tamsulosin targets. He will decrease the prostate size if he having a problem with his prostate size. But he's taking tamsulosin for that. He's taking tamsulosin most probably.
انت سألتني ولا ايه؟
لا انا ما كنتش عارف الكيس دي.
مين اللي كان معايا؟ كانت سلمى وميسة تقريبا صح؟ في حد سألني هو بياخد ايه؟ قلت لك ايه؟ prostatic hypertrophy right؟ صح؟ قلنا الكلام ده. بس فهو بياخدها عشان كده. بياخده عشان كده. التاني هو مشكلة التاني mainly عشان هياخد لسه 6 شهور. هو اوريدي بقاله 3 شهور بياخد ده.
واصلا كنترول يا دكتور صح؟ كنترول ده على التمثيلوس، الكنترول ده هو على التمثيلوس
هو كنترول ده بالظبط كده.
طيب خلاص هغير الكلاس ليه يعني
بالظبط كده.
هفضل مع نفسي.
ملناش حاجة، ملناش علاقة ان احنا نغير. بالظبط ملناش حاجة قصدي ان احنا نغير. هنكمل بس هنغير المولكيول نفسه within the same therapeutic class.
تمام. طب يا دكتور دلوقتي what about
sorry guys, we have to speak in English. Sorry Oliza and Rashmi. We're speaking Arabic. Lisa says
عشان كده بقالي كتير والله
not everyone speaks this language. It's Arabic. Sorry guys. Okay.
Sorry, I have a question.
Yeah, go ahead.
So with in the study with alpha-zolpidem, it's written like with antihypertensive medication, it causes decrease in systolic and diastolic blood pressure. So are we still prefer to use it?
Which one? Tamsulosin?
Alpha-zolpidem.
Alpha-zolpidem?
Yeah.
Yes. By the way, 3 of them actually. الثلاثة هم بيعملوا كده. The 3 of them may cause that hypertension.
بس هو مكتوب على ده بس ان هو يعني التاني بيعمل hypostatic hypotension, orthostatic hypotension اللي هو التمثيلوسين، لكن الالفوزوسين affect the systolic with diastolic blood pressure, decrease them.
Decrease both. Okay. For me, I would go with the reference actually. Reference بيقول this one alpha-zolpidem gives less lower frequency of hypotensive than the tamsulosin. This is a bold line here. The bold line, bold information that I'm looking for.
But the reference say it's only like and the orthostatic hypotension. Like the table you show, it's only about orthostatic hypotension. But in the article itself, it say alpha-zolpidem decreases systolic and diastolic blood pressure.
Okay.
So it means it has the side effect of decreased blood pressure.
Yes, it could happen by the way. فين هي؟ لقيتيها فين؟ هنا؟ Yes.
In the adverse drug event.
Yes, this one.
Not the table, just the text down.
Here, right?
No, down.
Side effects. Let me check. The proportion of patients.
Sorry, it's down in the adverse drug event.
انزل تحت, scroll down or scroll up?
Yeah, scroll down.
Yes. Maximum flow rate. Usually it could happen, yes. When compared to
just before the conclusion,
psilocin and tadalafil had a significantly higher incidence of adverse effects event. Okay. The primary specific they are reported for dizziness, headache, and anesthesia. Bandital observed abdominal ejaculation, normal ejaculation with psilocin and orthostatic hypotension only, and orthostatic hypotension only with tamsulosin. Here we go. They reported psilocin to be useful for elderly patients and alpha-zolpidem for younger sexually active men. However, we observed that ADE was the maximum. The psilocin, at least with tamsulosin, observed that alpha-zolpidem with antihypertensive medication decreased systolic and diastolic blood pressure. Okay. مع other medications you mean, right?
Yeah.
With other hypertension medication decreases systolic and blood pressure. And this is normal, by the way.
Yeah, I know it's
It,
normal,
it,
but
it,
this
it
is his
doesn't
complaint.
surprise me. It doesn't surprise me. No. Other hypertension was observed with tamsulosin mainly, 3%, but not aflatoxin. Yes, here we go. No, for me, it would change nothing in my decision, actually. I would go as well with either both of one, لو alpha-zosin
ليش ان
or
هو ان like لو taken parallelly مع hypertensive، ما فيش hypertensive medication هنا.
بالظبط. There is no hypertensive medication.
ما فيش مشكلة هنا.
Yeah,
but quetiapine, it has alpha effects. That's why act like
no,
antihypertensive.
don't complicate your lives, guys. don't complicate it like that.
Take it easy. Take it easy.
Yeah, take it. It's not like
the stations should be like simple, not like.
Yeah, مش هندخل بقى في كل ده اصل ده بيعمل ايه وبتاع. ده it may cause venlafaxine may cause a hypertension.
اصلا venlafaxine كده بالظبط
the dose it takes
300 هيكون اصلا hypertensive اصلا.
بالظبط كده، ومع ذلك ما بيحصلوش hypertension، بيحصل له hypertension. It could happen, yes, it could happen.
Yes, but it's not with every case. يعني it's okay. Take it easy.
Yes. تمام. بس that's it. Everything was controlled till he started taking the tamsulosin. This is the problem. تمام. That's it. Is it clear? Let's stop the recording here.
Thank you, Doctor.
I'm gonna stop the recording. I stop recording.